Let me take you straight into it. Pancreatic cancer is often called a silent killer, not because it's untreatable, but because it can quietly develop without obvious symptoms until it's advanced. And that's why today is so important. I want you to know the subtle, often overlooked signs that could mean your pancreas is in trouble. My goal isn't to make you fearful, it's to make you aware, so you can take action early when it matters most. You deserve to know what your body might be trying to tell you. Before we start, let me ask you something. Have you or someone you love ever experienced unusual digestive symptoms or unexplained changes in your health and wondered if it could be serious? Share your thoughts or stories in the comments below. You never know who might benefit from hearing your experience. The first silent sign I want you to know about is persistent abdominal or back pain. This isn't the occasional stomach ache we all get from eating too fast or too much. I'm talking about discomfort that lingers for weeks, sometimes radiating from the upper abdomen to the back. It can be dull, deep, and constant. People often dismiss it as muscle strain or indigestion, but when pain becomes a steady background presence, it's your cue to listen closer. I tell my patients, if it's not going away and you can't explain it, it's worth checking out. The second sign is unexplained weight loss. Now, many people think of weight loss as a good thing, but when you're losing pounds without trying, and especially if your eating habits haven't changed, it's a signal that your body might not be absorbing nutrients properly. In pancreatic cancer, the tumor can interfere with digestion, preventing your body from breaking down food effectively. This leads to muscle loss, weakness, and sometimes changes in appetite. If the weight just seems to melt away and you can't figure out why, that's not good luck, that's a red flag. Third is jaundice, or a yellowing of the skin and eyes. This happens when the tumor blocks the bile duct, causing a buildup of bilirubin in the blood. Jaundice often comes with dark urine, pale stools, and itchy skin. What's tricky is that it can appear before any pain does, so people don't associate it with something serious. If you notice yellowing, even if you feel fine otherwise, please don't wait. Get it checked. The fourth silent sign is changes in stool. I know it's not the most glamorous topic, but it's one of the most telling. Oily, floating, or foul-smelling stools can signal that your pancreas isn't releasing enough digestive enzymes. This is called steatorrhea, and it can happen when the pancreatic ducts are blocked. You might notice that it's harder to flush, or that there's an unusual sheen on the water. Paying attention to these details can literally save your life. The fifth sign is new-onset diabetes, especially if you're over 50 and have no other major risk factors. The pancreas plays a key role in producing insulin, and when it's affected by cancer, blood sugar levels can spike unexpectedly. Sometimes diabetes is the very first sign of pancreatic trouble. If your doctor diagnoses you with diabetes and it seems to come out of nowhere, ask about further testing for your pancreas. The sixth sign is nausea and vomiting, which can occur if the tumor presses on the stomach and blocks part of the digestive tract. This might happen especially after eating, leading to early fullness, bloating, or the sensation that food isn't moving through. While these symptoms are common in many other conditions, their persistence, especially in combination with other signs, should never be ignored. And finally, the seventh sign is fatigue. I'm not talking about the "I stayed up too late" kind of tired. This is deep, bone-heavy exhaustion that doesn't improve with rest. It can be the result of your body working overtime to fight the disease, combined with poor nutrient absorption and changes in metabolism. When fatigue lingers and starts affecting your daily life, it's time to take a closer look at what's going on beneath the surface. Now, I know that hearing these symptoms might feel overwhelming, but here's what I want you to remember. Having one or even a few of these signs doesn't mean you have pancreatic cancer. These symptoms overlap with many other conditions, some minor, some more serious. The key is persistence and combination. If these signs appear together or they stick around without a clear reason, That's when it's time to advocate for yourself. I've seen firsthand how early detection can make a difference. Yes, pancreatic cancer is challenging to detect, but it's not impossible. Awareness is the first step. That means noticing changes, keeping track of them, and not being afraid to speak up to your healthcare provider. You know your body better than anyone. If something feels off, even if you can't explain it, trust that instinct. I also want to emphasize the power of routine checkups and honest conversations with your doctor. Blood tests, imaging studies, and even endoscopic procedures can help uncover problems early. And if your symptoms are dismissed, it's okay and sometimes necessary to seek a second opinion. You are your own best advocate. Another point I always make is lifestyle. While we can't control every risk factor, we can lower our risks through diet, exercise, and avoiding smoking. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports pancreatic health. Staying active helps regulate weight and blood sugar. And avoiding tobacco dramatically reduces your risk for not only pancreatic cancer, but many other serious diseases. I understand that health conversations like this can stir up anxiety. My aim is not to alarm you, but to empower you. When you know the signs, you can take action sooner. The truth is, the pancreas is a small organ with a big job, and when it's in trouble, the clues are there, if you know where to look. So here's my invitation to you. Don't ignore your body's quiet messages. If you notice persistent abdominal pain, unexplained weight loss, jaundice, stool changes, sudden diabetes, nausea, or fatigue, make that appointment. Write down what you've noticed. Be specific with dates and details. This helps your doctor piece together the bigger picture. And if you're watching this because someone you love is going through health challenges, share this knowledge with them. Sometimes information is the greatest gift you can give. Your health is worth protecting. Your life is worth the effort it takes to investigate the unknown. Every early diagnosis starts with awareness, and now you have that. I'm here to remind you that you're not powerless in the face of something scary. You have the ability to notice, to ask, and to act. Thank you for spending this time with me today. Your commitment to learning about your health tells me you care deeply about your future. Keep listening to your body, stay informed, and never hesitate to get the answers you deserve. And now, I'd love to hear from you. Have you experienced any of these symptoms, or do you have tips for paying closer attention to your body's signals? Share your thoughts in the comments. Your story could be the one that inspires someone else to take action. And if you found this information helpful, consider subscribing so we can keep having these important conversations about your health. You deserve the best chance at a long, healthy life, and that begins with knowledge, awareness, and the courage to act on it.